Did you know there are 5 simple exercises that can make you feel and move as if you were 20 years younger? Many people accept getting weaker and more fragile over time, but the good news is that there's a training approach capable of reversing signs of physical aging in just a few weeks. In this piece, I present that approach and the 5 science-based exercises you need to practice to stay strong and healthy, especially after 50. Before we get into the movements, it's worth understanding a key factor that affects longevity and mobility and is often underestimated. In 1989, researchers coined the term sarcopenia, from Greek roots meaning loss of flesh, to describe the age-related decline in muscle that starts as early as the 3rd decade of life. What wasn't known at the time was how fast this process accelerates after 50. In 2019, sarcopenia came to be formally recognized in clinical classifications and specialized guidelines because it became clear that it's one of the main drivers of frailty, disability, and falls in older adults. The good news is that recent studies show sarcopenia is preventable and can be reversed when the right stimulus is applied consistently for about 12 weeks. Not every exercise works equally well. Poor choices or training without a method make you waste time and sometimes even get hurt. That's why the strategy I recommend combines 3 principles. First, foundational strength with an eccentric emphasis to regain mass and functional density. Second, power done safely to bring back speed and prevent falls. Third, mobility and motor control to reduce stiffness and pain. With that in mind, the 5 exercises below make up an efficient and scalable mini protocol. 5 exercises for functional rejuvenation. 1. Controlled sit to stand from a chair. Adjust the height so the hip is a little above the knee. Cross your arms over your chest to avoid using momentum. Lower in 3 to 4 seconds, keeping the knees aligned with the second toe, and rise in 1 to 2 seconds with the torso tall. This pattern strengthens the quadriceps and glutes and improves chair rise time, which is a functional marker of aging. Trials in older adults show that training focused on this action improves performance on 5 repetition tests and reduces fall risk, according to 2019 International Consensus Statements. 2. Deadlift, hinge pattern. Use light dumbbells or a light kettlebell. Starting from the floor or from a support at shin height. Stand with feet hip-width apart. Push your hips back while keeping a long spine and an open chest. Think about pulling your armpits toward your torso to engage the lats. Stand up by extending the hips and knees at the same time. The hinge restores posterior chain strength, protects the lower back, and improves your ability to pick objects up from the floor safely. Clinical reviews report strength gains and reduced low back pain when you train the hinge pattern with gradual progression. 3. Standing band row. For active scapulae, anchor the band at chest height, slightly bend your knees, brace your core and pull your elbows back, finishing the movement by squeezing the shoulder blades as if you wanted to bring them together. Avoid shrugging your shoulders. This work strengthens the rhomboids and rear delts, improves posture, and counterbalances years of in-front-of-the-body activities like typing and driving. Studies indicate that improving scapular control reduces cervical overload and frees thoracic range of motion. 4th, controlled step-up. Choose a stable step 20 to 30 centimeters high. Place your whole foot, press through your heel, and come up without pushing with the lower leg. Descend slowly to train eccentric braking and alternate legs. Step-ups increase oxygen consumption, improve balance, and carry over to real-life tasks like climbing stairs and negotiating uneven ground. Interventions using this pattern show improvements in walking speed and independence on 6-minute walk tests, according to active aging reviews. 5. Farmer's walk with a light load. Hold 2 light dumbbells or bags with sturdy handles. Walk in a straight line while keeping a long neck, shoulders down, and an active core, as if you wanted to grow toward the ceiling. This simple exercise integrates the wrist, forearm, shoulder, core, and hip, and it improves lateral stability and grip strength, which is associated with health outcomes in later life, according to population analyses. Practice 3 times per week on alternating days. Perform 2 to 3 sets per exercise with 8 to 12 repetitions for the first 4, and walks of 20 to 40 meters for the 5th exercise. Progress once your technique feels stable. First, increase repetitions and duration before adding load. Maintain nasal breathing with a long exhale to reduce stiffness and modulate the nervous system. Warming up with simple joint movements such as ankle, knee, hip, and shoulder circles. For 3 minutes, prepares tissues and lubricates the fascia. The combination of controlled eccentric contraction and light power stimuli promotes fascia remodeling and improves gliding between layers. The muscles respond with increased protein synthesis when the stimulus is progressive and sufficiently challenging. Meanwhile, moderate speed recruits fast twitch fibers that are lost with age and are crucial for quick balance corrections. This explains why many begin to feel steadier steps and less pain in 2 to 4 weeks and see clear gains in 12. Acute pain is assigned to stop and assess. Those with osteoarthritis or osteoporosis should prioritize technique, a comfortable range of motion, and low loads at the start with small progressions. If there's a recent history of falls, dizziness, or surgery, seek professional clearance and customize step heights and training volumes. Keep the routine short and to the point. 7 to 12 minutes already deliver benefits when done well. Pair brisk walks on alternate days with short stair climbs throughout the day. Mind your daily protein. Distribute it across meals, 20 to 30 grams per meal, to support muscle, according to nutrition guidelines for healthy aging, and maintain adequate hydration. In summary, it isn't about grueling workouts and long hours at the gym. It's about choosing movements with the best transfer to real life, performing them with attention and progression, and giving your body the consistency to respond. The result is a tangible sense of functional rejuvenation that translates into standing up and walking with more confidence, carrying groceries without fear, and enjoying activities with renewed energy, supported by solid evidence from Sarcopenia consensus statements and modern reviews of training for older adults. Now you're going to learn about the 5 most effective anti-aging exercises and the approach that many researchers describe as the gold standard for reversing muscle mass loss at any age. Starting with exercise number 1, squats. Squats are a nearly universal recommendation for people over 50. They recruit the largest muscle groups in the legs, glutes, quadriceps, and hamstrings, which are essential for walking, climbing stairs, and standing up from a chair. Squats also engage the back and core, creating stability and endurance in the torso, which makes everyday tasks easier, such as lifting objects, bending safely, and carrying weight. To perform a squat with proper technique, place your feet shoulder-width apart. Extend your arms forward or cross them over your chest to avoid using momentum. Inhale through your nose and start the movement by bending your hips and knees at the same time, as if you're going to sit. Pause briefly at the lowest point while keeping your spine long and your gaze straight ahead. As you exhale, return to a standing position by activating your glutes and quads. Start with 2 sets of 10 repetitions and, as you gain control, gradually increase. To make it more challenging, use a dumbbell between 4 and 7 kilograms. To make it easier, use a chair to slowly sit and stand, optionally touching the armrests lightly for balance. Before turning squats into a daily habit, there's a crucial principle to prevent frustration and injury. Progress steadily rather than with bursts of intensity. Challenge yourself to increase your practice time or weekly volume by about 20% each week. This simple and powerful rehab rule respects the adaptation pace of muscles, tendons, and fascia. A practical example: a 60-year-old person who, after back pain, could only tolerate walking for 10 minutes a day, began doing controlled squats and short walks. By applying the 20% progression weekly, they tripled their walking time in 2 months, returned to gardening for an hour, and regained the strength to play on the floor with their granddaughter. The message is that progress doesn't have to come with suffering. It needs a method. Because they combine base strength and eccentric control, improve hip coaptation, strengthen the posterior chain, and teach the body to resist gravity in an organized way. The gold standard for reversing muscle loss is progressive resistance training. When we combine this type of stimulus with well-executed squats and a consistent routine, the body responds with strength, mass, and functional density gains in 12-week cycles. Literature reviews in active aging report improvements in the site-to-stand test, reduced fall risk, and increased walking speed when squats are trained progressively. For those with knee instability, use the box squat technique. Sit lightly on contact, rise in a controlled manner. Ensure your knees align with your second toe, and distribute weight through the midfoot and heel. For advanced practitioners, try the goblet variation. Hold the dumbbell in front of your chest to help keep your torso upright and engage your core more effectively. For ankle stiffness, elevate your heels 1 centimeter using a thin weight plate or folded mat while working on mobility on alternate days. For a sensitive lower back, reduce range of motion initially and prioritize a slow tempo during the descent. Never hold your breath. Use long, silent exhalations to reduce unnecessary tension. Adjust weekly volume according to your recovery. 2 or 3 sessions per week are usually enough to progress. Combine with moderate walks on alternate days to improve tissue perfusion and consolidate motor patterns. A sign that you're on the right track is feeling effort in the target muscles, not pain in the joints. Acute joint discomfort requires rest and adjustment. For those with osteoarthritis, osteoporosis, or a recent fall history, start with a comfortable range and light loads. Focus on technique and make small, continuous increases. From a physiological perspective, squats provide mechanical stimulus that activates protein synthesis pathways and supports fascia remodeling, improving layer glide, and reducing stiffness. When tempo is controlled, stretch receptors recalibrate the sense of safety at greater ranges, the core learns to stabilize with less unnecessary co-contraction, and the whole body moves more efficiently. That's why so many people report firmer steps and less pain when standing within 2 to 4 weeks, and clear improvements in climbing stairs and overall vitality within 12 weeks. A safe and practical plan includes a short warm-up with 3 minutes of light joint mobility, 2 to 3 sets of 8 to 12 squats, 45 to 60 seconds of rest, and a short walk afterward. Adjust the chair height so your hips are slightly above knee level if you're just starting. To intensify without greatly increasing the load, introduce 1-second pauses at the bottom and 2-phase rises. Another way to progress is to increase the number of reps every other week and only then add weight. Also support your progress with good nutrition. Distribute high-quality protein in each meal, 20 to 30 grams per meal, along with proper hydration and responsible sun exposure for vitamin D when possible. All these factors enhance squat gains. If you want a simple progress marker, track how long it takes you to do 5 controlled sit-to-stands without support and with steady nasal breathing. Improvement in this test usually reflects real autonomy gains. In summary, squats hold the #1 spot among exercises that fight physical aging because they increase strength, practical power, and balance in a single motion, with direct carryover to daily life. When implemented within a progressive resistance program and under the rule of steady 20% progression, you build solid, lasting results safely and patiently, supported by consistent findings in modern rehab and active aging guidelines. We move on to exercise number 2, the modified abdominal exercise. An excellent choice for strengthening the core in a safe and effective way by targeting not only the rectus abdominis, the six-pack muscle, but more importantly, the deep layers that stabilize the spine and work together with the back muscles. Lie on your back with your knees bent and feet on the floor or bed with your hands resting on your thighs. First, align your pelvis and torso by gently pulling your belly button toward the floor while softening the lower back curve. This subtle posterior tilt often relieves discomfort for people with back pain. Inhale through your nose, and as you exhale, lift your shoulder blades off the surface as if you're trying to slide your hands toward your knees. Lift only enough to feel your abs working without pulling on your neck. Keep the back of your neck long, as if holding an apple under your chin. Hold at the top for 1 second and slowly lower back down with control. Quality matters more than quantity. 2 sets of 15 repetitions work very well for most people. If you have neck sensitivity, lightly support your head with your hands without pulling, and think about bringing your ribs closer to your pelvis as you exhale continuously. To progress, increase the height of your torso, add a lightweight plate over your chest, or increase the number of reps while maintaining control. To make it easier, perform a partial version by lifting only the head and shoulders 1 or 2 centimeters. The key is to keep the core engaged and breathing steady throughout the movement. Because training anterior trunk control with an emphasis on exhalation stretches the posterior chain, improves the synergy between the diaphragm, transverse abdominis, and pelvic floor, and reduces unnecessary co-contractions that stiffen the lower back. Clinical studies show that motor control and core strengthening protocols reduce low back pain and improve daily function in older adults when done 3 to 4 times per week over a 12-week period with gentle progression. Common mistakes include holding your breath, pulling the head with the hands, and coming up too fast. Correct with controlled tempo, long exhalation, and focus on feeling the core deepen. Exercise number 3 is the reverse lunge, a more beginner-friendly variation than forward or walking lunges. Start with your feet shoulder-width apart and hold the back of a chair or a counter for light support. Keep your torso upright, take a wide step back and lower your body as one unit by bending your hips and knees. The front leg should form a near 90-degree angle with the knee aligned over the second toe. The back leg stays on the ball of the foot, with the knee bending toward the floor. Stop before you feel any joint discomfort. Push the ground with the front heel to return to standing, keeping your hips stable and core engaged. This movement strengthens the gluteus maximus and medius, quads and hamstrings, trains eccentric braking that protects the knees, and improves lateral hip stability, so important for fall prevention. It also engages the lats and core to offload the spine. Regular practice improves joint health in the knees and hips and supports bone density through controlled mechanical impact, reducing osteoporosis risk when included in a progressive resistance program. For a beginner version, use light touches on the support for each rep, reduce range of motion, and keep the step short. For an intermediate level, let go of the support and add a 1-second pause at the bottom. For advanced trainees, hold light dumbbells at your sides or in a goblet position in front of your chest and use a tempo of 3 seconds down and 2 seconds up. Start with 2 sets of 8 to 10 repetitions per leg and increase weekly, following the 20% progression rule. If you feel unstable, reduce the range of motion and train near a support until you gain confidence. Signs of correct execution include a stable front knee without caving inward, a firm heel on the floor, and an upright torso without leaning forward. Those with patellofemoral pain can keep the front shin more vertical and think about sitting the hips back rather than letting the knee go past the toes. Ankle stiffness can be managed with a slight heel lift on the front foot until mobility improves. Complement with nasal breathing and long exhalations to help regulate the nervous system and reduce tension. Structure your session with a 3-minute warm-up, the modified abdominal exercise, the reverse lunge, and a short walk at the end to reinforce motor patterns. Within 2 to 4 weeks, it's common to notice improved balance and less discomfort when going up and down stairs. After 12 weeks, the combination of a stable core and a strong lower chain results in greater autonomy for standing, squatting, carrying, and walking safely. Everything guided by consistency and gentle progression, which the mature body responds to best. In the reverse lunge, lower yourself smoothly and with control, without touching the knee to the ground, aiming to stop between 3 and 5 centimeters from the floor. Then return to the starting position in one continuous motion, keeping your core engaged and breathing throughout. Repeat on the other side, starting with one set of 10 repetitions per leg. If you have knee or hip arthritis pain, begin with mini lunges, reducing the range of motion to about a quarter depth. For those with more strength and mobility, you can release the support and hold a dumbbell of around 4 to 5 kilos in each hand, while still maintaining controlled tempo and focus on alignment. Again, perform one set of 10 per side and gradually increase depth and reps as your strength improves. After building lower body and core strength, we move on to key upper body muscles. Exercise number 4 is the modified push-up. Push-ups build strength in the chest, shoulders, and triceps, and also engage the core, improving your ability to lift, push, pull, and carry in everyday life. To begin safely, place your hands on the floor slightly wider than shoulder width, with knees supported. Keep your body in a straight line from head to feet by activating your core. Lower yourself by bending your elbows until your chest is close to the floor without touching, then push back up slowly and steadily, keeping the torso stable. Perform 2 sets of 10 repetitions. If there's shoulder discomfort or limited mobility, use the wall version. Stand at a comfortable distance from the wall, place your hands at shoulder width, bend your elbows to bring your chest toward the wall, and push back to the starting position. To progress, step your feet slightly farther from the wall or use the firm edge of a countertop. Once you have enough strength and mobility, move to the full version with support on your feet, maintaining a straight line from head to heels and a firm core. In any variation, keep a smooth tempo and gradually increase volume. Key technique tips for push-ups. Keep your shoulder blades active, as if gently pushing the floor away to avoid collapsing between the shoulders. Think of spreading the floor outward, with your hands to engage the external rotators and protect the front of the shoulder. Keep your wrists neutral and neck long, avoiding jutting the head forward or holding your breath. Rehabilitation literature highlights that closed chain pushing progressions improve upper limb strength without overloading sensitive structures, as long as tempo and alignment are respected. Now for exercise number 5, the glute bridge, which I consider a powerful indicator of overall mobility and strength across the decades of life. Lie on your back with knees bent, feet hip-width apart on the floor, and arms at your sides with palms facing down. First, engage your core by gently drawing your belly button inward to activate the deep abdominal layers. As you inhale, push through your heels and lift your hips to a pain-free height, squeezing your glutes at the top. The body doesn't need to be perfectly aligned. The goal is to go as far as control allows. Hold briefly at the top, keeping glutes and core engaged, and lower slowly while exhaling. Aim for 2 sets of 10 repetitions. To make it more challenging, progress to a single leg bridge by extending one leg during the lift, which greatly increases demand on the gluteus medius and lateral stabilizers. If you need to simplify, start by simply contracting and holding the glutes with low hips, then lift 1 to 2 centimeters, and progress as strength improves. 2 key precautions for people over 50. Keep the core engaged throughout and avoid overextending the lower back. Focus on the feeling of hip extension rather than arching the spine. Always perform the movement smoothly and with control. Why this triad is so valuable? Because it covers the major functional patterns: push, pull, stabilize, squat, and locomotion, while delivering stimuli that promote hypertrophy and practical power without stressing joints, when performed with progression and good technique. Progressive resistance training is considered the gold standard for combating age-related muscle and strength loss. When combined with movements that transfer directly to daily life, adaptations appear faster and last longer. Recent reviews on active aging report improved autonomy and reduced fall risk when a program includes strengthening of the glutes, quadriceps, back, and core with small and consistent weekly progressions. Guidelines published in recent years emphasize that technical quality, a frequency of 2 to 3 sessions per week, and gradual increases in load or volume outperform sporadic, high-intensity approaches that often lead to pain and dropout. Aim for 3 non-consecutive training days, beginning with 3 minutes of joint mobility warm-up. Perform squats, reverse lunges, modified push-ups, resistance band rows, if they are part of your protocol, and glute bridges. Keep the repetitions between 8 and 12 for each exercise, and perform farmer's walks of 20 to 40 meters if using this loaded carry variation. Rest between 45 and 60 seconds. Approach progression using the rule of increasing volume or difficulty by around 20% per week, depending on your tolerance. Prioritize more reps and time under tension first, then range of motion, and lastly, load. Use nasal breathing with long exhalations to keep the nervous system calm and reduce inefficient co-contractions. Over the weeks, track simple functional markers, standing up from a chair 5 times without support and without holding your breath, climbing a flight of stairs with a firm step, holding a 20-second glute bridge with hips aligned, and completing 10 wall push-ups with control. These milestones are practical signs that your movement patterns are improving. At the same time, take care of the foundational pillars that enhance your gains. Adequate protein intake distributed throughout the day with 20 to 30 grams per meal, sufficient hydration, consistent sleep, and moderate walking on alternate days. Small doses of sun exposure for vitamin D synthesis when appropriate, and attention to energy balance to support protein synthesis. Regarding safety, acute pain stops the session and calls for adjustment. Those with a history of severe osteoporosis, recent surgeries, dizziness, or radiating pain should begin with reduced ranges of motion and supervision until symptoms stabilize. Remember, the mature body responds better to consistency than to the heroics of a single day. Noticeable improvements in balance, ease of standing, and walking stability often appear within 2 to 4 weeks, with clear progress in 12 weeks. From that point on, maintaining progress becomes easier because the routine is already in place, and movement once again becomes a solid ally in your aging process, supporting strength, mobility, and autonomy. Leave a like, subscribe to our channel, and comment where you're watching this video from and your age.